My philosophy around dating is old-fashioned method, so I do believe in courting in a sense where there's dates leading up to kind of, I don't know, the initial, there has to be some kind of chemistry, and I believe that starting off as friends is always a better route to go first. And then if it develops from there, I do like someone to ask, you know, to be your girlfriend or to have that relationship kind of solidified by the question, I guess. I really would like to have kids, hopefully boys, and hopefully they're sports players. I've been using birth control for a little less than 10 years, I think, give or take. And I've tried a lot of different methods, and I definitely feel that the Mirena is the one that works best for me. What I was on before was an implant in my arm. I was using that method for a long time, I would say a couple of years. Prior to that, I was on the pill. I just did not find it consistent. So my doctor at the time had recommended the arm implant. And worked great, it was fine, but then when the new product, the Mirena, the IUD came out, I guess they kind of had worked out the kinks, and I just felt that that was a better method to go with. And it's great. It was an easy insertion. The doctor was wonderful. For the first couple months, they did warn me that there would be kind of abnormal bleeding, which there wasn't. It wasn't out of control because I usually have regular periods anyway, so maybe a couple days through the month I would spot, and that was for the first 6 months. But then after that, my periods have been very, very light, maybe 2 days at most. When I signed up for the Mirena originally, my medical provider actually covered the cost, and I just actually had a $15 or I believe $20 copay, so it was awesome because it was only $15 or $20 and they covered the rest. If I had to do the Mirena all over again, I would definitely pay for it up front if I didn't have medical coverage, because it definitely outweighs, it has more benefits than not, and it definitely outweighs having to pay for, say, the pill or the patch every single month. It's good for 5 years, and I know that now that my body's adjusted to it, that my periods are consistent, and I have the protection without having to make an appointment every month. My name's Jenna, and I'm 24 years old, and I use the Mirena IUD.